Hi, good morning Randy. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 13th of May 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Randy Wrigley.
And what is your candidate number, please?
My candidate number is 253815557.
Thank you. Are you taking this test as a nurse?
Yes, I am.
All right. Can I see your ID, please?
Sure. Here it is.
Okay. Now, let's move on to warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What is the purpose of the OET?
The OET is an English language test that assesses the language proficiency of healthcare professionals who want to work or study in an English-speaking environment. The OET covers the 4 language skills of listening, reading, writing, and speaking, with an emphasis on communication in healthcare settings.
Why did you choose nursing as a career?
I chose nursing as a career because I have always been passionate about helping people and making a positive difference in their lives. I enjoy the challenges and rewards of nursing, such as providing quality care, collaborating with other healthcare professionals, and learning new skills. I also find nursing to be a fulfilling and meaningful profession that aligns with my values and goals.
What are your strengths and weaknesses as a nurse?
Some of my strengths as a nurse are my communication skills, critical thinking skills, and compassion. I can communicate effectively with patients, families, and colleagues using clear, respectful, and empathetic language. Moreover, I can empathize with patients and their situations and provide them with emotional support and comfort. Some of my weaknesses as a nurse are my delegation skills and my stress management skills. I also find it hard to delegate tasks to others when I feel that I can do them better or faster myself.
How do you handle conflict or difficult situations in the workplace?
When I encounter conflict or difficult situations in the workplace, I try to handle them professionally and respectfully. I follow these steps. First, I listen actively and attentively to the other person's perspective without interrupting or judging them. Second, I express my perspective and factual information without blaming or criticizing them. Third, I acknowledge any common ground or shared interests that we have and try to find a solution that is acceptable and beneficial for both parties. Fourth, I thank the other person for their cooperation and feedback and follow up on the agreed actions or outcomes.
How do you ensure patient safety and quality care?
Patient safety and quality care are my top priorities as a nurse. To ensure this, I follow these practices. First, I adhere to the standards of practice and code of ethics of the nursing profession. Second, I follow the policies and procedures of the healthcare organization. Third, I use evidence-based practice and best practices to guide my clinical decisions and interventions. Fourth, I document accurately and thoroughly all aspects of patient care in the electronic health record. Fifth, I communicate clearly and promptly with patients, families, and other healthcare providers about patient conditions, care plans, progress, and outcomes. Sixth, I participate in continuous education and training to update my knowledge and skills.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-play card, if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role-play. Don't worry if I stop you when the time is up.
Mihiraa, I have completed your wound dressing successfully. Before we conclude, do you have any questions?
Nurse, I'm a bit worried about my recovery. I have several discomforts which I think are causing some trouble.
Oh, I am sorry to hear that. You are going through some complications. If you don't mind, could you please tell me the symptoms you experience?
Sure, I am experiencing several symptoms. Firstly, I found my wound red and swollen, and it hurts when I move. I am also having constipation.
I understand your concerns. Don't worry, Mihiraa. I will clarify your concerns. Let's first discuss your concern about the wound. Based on the wound management I did today, I can confirm that there is no sign of infection or complication.
Okay.
But, as you said, I can see some bruising and swelling around the incision site, which is normal after surgery. Additionally, I don't see any pus, drainage, or foul smell, which are signs of infection. That means there is no point in your fear. Well, Mihiraa, could you please tell me how you care for your wound?
Nurse, I change the dressing once a day, as the doctor told me to. And I clean the wound with soap and water before applying a new dressing.
Excellent. And are you taking your pain medication as prescribed?
Well, not really. I don't like taking pills. They make me feel drowsy and nauseous.
I see. Well, Mihiraa, pain medication is important to help you heal and prevent complications. If you don't take it as prescribed, you may experience more pain and inflammation, which can delay your recovery and increase your risk of infection.
All right, nurse. I wasn't aware of this. I will take them as instructed.
Apart from that, I would like to inform you of other care and management you need to follow.
Sure, you may please. It will be of great help.
Thank you for your willingness to listen to me. You should also avoid activities that put a strain on your abdomen, such as lifting heavy objects, coughing, sneezing, or straining during bowel movements. These can cause your wound to reopen or bleed.
Oh, I didn't know that. I've been trying to do some light chores around the house to keep myself busy.
I appreciate your effort, but you need to rest and take it easy for at least 6 weeks after surgery. Your body needs time to heal and recover from the surgery. You can do some gentle walking or stretching exercises to improve your blood circulation and prevent blood clots. But avoid anything that causes pain or discomfort in your wound area.
All right. What else do I need to know?
You need to keep your wound clean and dry and follow your doctor's instructions for dressing and showering. You should avoid soaking the wound in water until your doctor clears it. You should also watch for signs of infection, such as redness, swelling, warmth, drainage, bleeding, or opening of the wound. If you notice any of these signs, call your doctor right away.
Okay. I understand your words.
Next, we can talk about your constipation. You should eat a high-fiber diet and drink plenty of fluids to avoid constipation and straining. Constipation and straining can put pressure on your wound and cause problems.
What kind of foods should I eat?
You should eat foods that are rich in fiber, such as fruits, vegetables, whole grains, beans, nuts, and seeds. You should also drink at least 8 glasses of water a day, or more, if you are thirsty. Avoid foods that are spicy, greasy, or hard to digest, such as alcohol, caffeine, chocolate, dairy products, fried foods, or nuts with shells.
Thank you for the advice.
You're welcome. Mihiraa, do you have any other questions for me?
No, I think you covered everything.
All right. Before concluding, let me summarize what we have discussed so far.
Okay.
You were here to attend the follow-up care after your hernia repair surgery. After the completion of your wound dressing, you expressed your concerns regarding the redness of your wound and the pain you are experiencing. You also mentioned you have constipation.
Yes, correct.
I cleared your concern regarding your wound based on my observation during wound care. Since you were not taking the painkillers as prescribed by the doctor, I advised you of the importance of taking medication, as well as the complications of not taking it.
Yes, I understand that.
Great. Followingly, we discussed other measures to take care of, and signs to be cautious of. Finally, we talked about the ways to manage constipation and food to include and avoid for the time being.
Yes, nurse, it is clear to me.
All right then. I hope you have a smooth recovery and feel better soon.
Thank you very much. I'll try to follow your advice. Thank you for explaining everything to me.
My pleasure. Take care of yourself and have a nice day.
That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.